Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Guess what? Same old, nothing that really works. Well, here's an opportunity. Give us a call, 888-630-9625. That's 888-630-9625. When we're not on the air, if you'd like to get a hold of us, all you have to do is go to rosellecare.com. That's ROSELLECARE.com. And send us a note. We'll get back to you. And if you need to talk to us right away, call 703-698-7117, and one of my docs will get back to you and discuss your problem and see if there's anything that can be done from an integrative point of view, from standpoint of acupuncture, chiropractic, functional nutritional protocols, perhaps just lifestyle changes and so forth. You know, those things that work without drugs, without surgery, you know, naturopathic medicine, things of those directives. That's why we're here. That's why we do the program. We have a very interesting program for you today, one that you're marketed to, solicited to, told about, and in my opinion, sometimes wrongfully. And we're going to discuss that this Wednesday evening at the Roselle Center for Healing in our house presentation of our in-house continuing education program. But in studio to help me do that, and your host and presenter this Wednesday evening, Dr. Brice Miller. We're going to be talking about what? Hypertension, or as Dr. Miller calls, the silent killer, which often it is. And the thing that is that there's so many people that have their first strokes, first heart attacks, first kidney failures, first aneurysms, and so forth, that are a result of an uncontrolled hypertensive condition that has literally been unattended for decades. Dr. Miller, welcome to the program.
Thank you very much.
You know, this is a problem that most physicians see. Some have different guidelines for, but there's so many people that are on medications. Problem is that that not only is this condition, I think, improperly diagnosed, meaning that some people are on medications that shouldn't be, and some people are missed that otherwise should be dealt with, and there's other ways of dealing with it. But the medications have side effects that are destroying people and making their health worse. So what I want to ask you first to start out the program is simply this. What is the parameters? I know that over 1/3 of our population, 1 out of 3 people suffer, according to medical standards, of hypertension. That's supposed to go up about 8 to 9% about 20% over the next 15 years if we keep doing the things that we're doing. So my question is to you, what is hypertension? You know, how do we know that we're hypertensive and it's not just white coat syndrome or something of that nature?
So hypertension is just going to be obviously a higher level of blood pressure than what should be normal. Your normal should be 120/80. And once you get to a level of above 140/90, and you've been that way consistently, you see it on multiple readings, on multiple visits, then you can be diagnosed with hypertension.
But, you know, here's my question with this. There's a lot of people that have blood pressures of 130, 138, over 70, over 74. Some go up to 145, but the lower pressure, what we call the diastolic pressure, is pretty adequate. It's low down. And they're treated, say, oh my God, you have hypertension. You go in a physician's office and that's what your reading is. But it isn't necessarily so, because as we get older, particularly in these type of situations, blood pressures have a tendency to be a little more elevated. But let me ask you this. In your opinion, what is a normal blood pressure, and let's give an age groups. Let's start with decades low and then move ourselves up. Normally a young guy that we see in the practice, if they're in great shape, and I'm talking about young, I'm talking about in their 20s and early 30s. If they're doing things correctly, they have a hypertensive attitude if they're above, 128. But we carry that paradigm on up. What do you know what the standards are relative to, as people get older, what is absolutely considered hypertensive?
I've heard a lot of different things. I know as you age, obviously your collagen gets softer, things stretch more, so the pressure has to be higher in order to maintain good pressure in the brain. One of the things I was taught in the past was 110 plus your age.
Plus your age.
And that gives you what your true systolic should be.
The problem is that caps off at a certain level that's only good up until you're hitting about your mid-30s, and then you've got to reevaluate.
True.
So the problem is, because if you get somebody who's in their 70s, my godfather, God rest this guy, he left us when he was 94 years old, and his blood pressure for years was aggravated, it was elevated, and so forth, and we found that it was not so much that he had any cardiovascular or renal problems. It was the fact that the man had a dietary pattern because of his work, and which caused inflammation, swelling, acid within the system, and he had a tremendous stress level that would cause him to be tense, and so his whole body was tense, driving his blood pressure up. Now, regardless of where it comes from, over a period of time, it can cause significance, it can cause damage. But let's move forward and let's talk a little bit about the different causes of hypertension as we know it.
Yeah, there's two different types of hypertension. One's primary and one's called secondary. Most of the cases you're going to see are going to be primary, which mainstream people don't really have any specific cause. They don't really know what's happening. They just know that the pressures are elevating. The secondary cases, which are secondary type, is much less common. It has to do with specific types of pathologies, kidney disease, things like that. But the primary seems to be the most important. Is more of a functional issue. So people are saying, well, there's no cause, let's just take some medication to bring this level back down. But you have to look and see there has to be something functionally incorrect in the system for these pressures to be rising like that.
My guest in studio, your host, is Wednesday evening, and we're going to be talking about hypertension, the causes and cures, if you will, at the Roselle Center for Healing in Fairfax. Love to have you join us. All you have to do is call us at 703-698-7117, 703-698-7117, and tell my staff that you'd like to be there for this very informative evening on hypertensive problems. And trust me, many of you are being medicated and shouldn't be medicated. You walk into the doc's office and he says, oh my God, you're outside the standard of 110 or 115 or 118 over 70 or 72. The problem is there's a lot more to be considered when it comes to that. And the question remains is why? Why is it at that level, regardless of whatever the number is? How come? Is it something that is naturally in your genetic bank that you're going to have hypertension? Is it cardiovascular problems? Is it renal problem? Is it distortion or trauma? But Dr. Brice, let's talk about that a little bit more. We're talking about primary causes and secondary causes, but that breaks it down into a huge paradigm. There's lots of different things that we can talk about. We talk about injury, we can talk about biochemistry, we can talk about stress patterns. What are people really looking at? And they're being medicated with all kinds of things, from tranquilizers to for diuretics to beta blockers and so forth. What are these underlying? Why is that?
One of the main causes that people have hypertension is because there's what's called resistance in your vascular system. So your blood vessels have more pressure behind them, they're narrowing, so there's more pressure, so the body has to pump harder to get the blood to go through, and this increased resistance in the system can come from all kinds of things, from vascular disease, stress can cause this, diabetes, injury to the spine, all kinds of different things like that.
Okay, let's talk about that. That's an interesting, that's in our field, spinal injury, and biochemistry is in our field, and acupuncture is in our field, and everything else, but that particular one. Injury patterns, guys and women who have participated in sports, they're going to get hurt. People who had small car accidents, they've been hit at 10 miles an hour, 15 miles an hour. People who have banged their head repetitively, albeit the fingers turn at me because I'm always smacking my head doing something of that nature. What's the effect when we talk about spinal related injury that causes blood pressure to elevate?
One of the main basic keys with spinal injuries is just the fact that there's two different sides to your nervous system. There's the sympathetic nervous system, which is your fight or flight mode. It makes you tense, it makes your pressure go up. And there's the parasympathetic nervous system, which is your resting state. So when you have a spinal fixation or an injury to the body, that sympathetic nervous system starts to elevate. And so when you go through the systems and you correct these structural imbalances, you get more of that resting parasympathetic nervous system back online, which helps your blood vessels relax, your pressure drops back down, and you feel more healthy, and you can heal yourself at that point.
You know, the parts of the spine that kind of relate to both of these, the structural research has been done. The upper portion of the neck, which we call the cervical spine, right between your skull and where your spine starts, is an area that really has a tremendous impact on the entire body, dampening the body, controlling that parasympathetic phenomena. The thoracic vertebrae, where your rib cage comes off, that spinal segment there seems to have a sympathetic reaction, fight-flight reaction. So if you want to increase the fight-flight pattern, you're going to look at that portion of the body. And sometimes, and here's my observation, Dr. Brice, tell me if I'm right or wrong. What I see with patients is that sometimes they're, patients who are more kyphotic, bent over in the thoracic area, they got a much broader camelback, if you will, have a greater tendency towards increased high blood pressure. I see it across, people get older, they start bending over, and it seems to be those patients are more hypertensive, if you will, because it's because of the sympathetic reaction than others. Mm-hmm. Is that your experience as well? Do you see that, and generally across the board?
Yeah, I see that a lot. The people that have that, highly kyphotic or bent over mid-thoracic area are going to have higher issues of hypertension because, not only is the spinal system affected, but you also have to look at the structure of the body. You're hunched over, you're not breathing as well. There's more compression on the actual heart itself. But again, like you were saying, that nervous system, sympathetic nervous system, is very affected by that spinal area. Yeah,
there's so much that's controlled. People forget that there's nerves that come out of the spine. They think, well, there's these nerves that come from the brain, and, the nerves from the spine, all they do is control muscular function. Well, the truth of it is that they control organ function and blood supply and lymphatic movement and all these things. And if that area particularly is not working the way it's supposed to, now you've got the potential, the probability of increased neurological irritation causing the blood pressure to start going up. So if you're on blood pressure medication, go stand up in the mirror, take a look. See what you look like. If you're not able to stand up straight, if you can't get that back of yours to be nice and straight and balanced, then the trouble might be coming from that area. Period. When we're dealing with organ systems, there are several organ systems, and I know that I'm laying this out because in the next half of the program I want to talk about some of the effects and what we can do about them. But what are some of the organ systems that that hypertension comes from? Is there anything to say, well, is it everything or everywhere, or are there actually, why is that behind all of this?
Sure. I mean, of course, any stress to the body, any organ system can lead to hypertension, but the main organs we're looking at here, specifically the kidneys. The kidney, and obviously the heart itself, and the vascular system, which you consider an organ. But the kidney function is paramount to having healthy blood pressure. Not only because it produces the chemicals and hormones that help regulate that, but it's also important in sensing pressure changes and adapting as kind of like a high-release valve for safety mechanism so your body doesn't have hypertensive crisis and cause itself damage. So the kidney, I'd say, would be the most important system to look at.
We have the kidney, everybody points to the heart and the cardiovascular vessels, and sometimes that's true, sometimes it's not true. And the tension within the arterial system, which is our friends, the adrenal glands, the fight-flight system, They put out something called angiotensin. Angio meaning blood vessel, tension, tense situation, increasing pressure. And that comes from stress patterns and anything that affects that adrenal mechanism. We're going to talk about the why and wherefore this Wednesday evening, the 19th of the month, 7:30 p.m. at the Roselle Center for Healing. I'd love to have you as our guest. Trust me, you're going to find out how to get off meds if it's possible. You're going to find out if there's a structural involvement. You're going to find out if there's energetic. You're going to find out if there's biochemical involvement if you attend this class. Wouldn't it be nice, maybe once and for all, to get off your meds? We're coming up to a break. Don't want you to go away. We're going to come back and talk about the whys behind all of this. You're listening to Dr. Tom Roselle Live. We'll be right back. You've been everywhere. You've done everything. And you still feel like, well, Did you know that your health and wellness starts with your brain and nervous system? What if by establishing normal brain and nervous system function, you could regain your energy, strength, and vitality? Would you be interested? I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me and an elite group of wellness practitioners for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that could change your life forever. A day when you'll learn step by step how to create a brain-body connection that will allow you to live in a state of wellness that you deserve. Register today at agelesshealth2015.com. That's agelesshealth2015.com. Or call 703-698-7117. Register today. After all, your health is a do-it-yourself program. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Indeed, we're in studio. It's hot outside. It's really, really hot. It's supposed to get in the high 90s today. And you know what? Stay cool. Don't overdo it. You can get outside, relax, enjoy it. But, today's a good day. Just kind of take a slight stroll with a lot of water. Put a little sea salt in your water. Sea salt. It will not make you hypertense. Sea salt. But don't go out for a long time. If you find that you're feeling weak, get out and get inside and either get that fan on or get the air conditioning going, because this is when we get in trouble. A lot of us think that, we're fit and ready to rock and roll. The unfortunate situation is that not so much. 888-630-9625. That's 888-630-9625. That's how you find us here in studio. And how you find us outside the studio, you can call 703-698-7117. That's the number also that you use to register for this Wednesday evening's program on hypertension, causes and cures at the Roselle Center for Healing in Fairfax. Give us our office a call, and your host, your presenter, my guest in studio, Dr. Brice Miller, will be talking about this and what you can do about this phenomena. Dr. Brice, let's get a little bit more in depth into this situation and talk about, we started to talk about the differentiation between, structural pieces and biochemical pieces and so forth. Let's talk a little bit about the biochemical pathways and the things that trigger this problem from a different set point.
Okay, so there's many different factors that can be involved biochemically with hypertension. One of the first and foremost, obviously, is being overweight. The obesity issue in the country is getting quite out of control, and this has a huge effect not only on the stress on your body and how that can affect the hypertension, but your adipose tissue or fat tissue produces a hormone called leptin, and this chemical, when released, has a linear effect of increasing blood pressure. So the more tissue you have, more fat tissue you have, the more leptin you're going to produce. The more leptin you have in your body, the higher your blood pressure goes. It's also associated with, sympathetic nervous system increase, again, which is going to cause that increase in hypertension. It causes some kidney damage, and it also increases your clotting. So it's not just about the fact that you're overweight and it's a stress on the system, but there's all these chemicals involved with that condition that can be really harmful to your blood pressure.
What people don't realize is that the kidneys I'm about to make a grammatical faux pas. The kidneys are one of the major problematic organ systems when it comes to hypertension, but there are others as well. And the kidneys, the reason for it, and we were discussing it on the way up to the show, is that the kidneys have these end little tubes called, we'll say DCTs, and that really means distal convoluted tubules. It's part of what we call the glomerular filtration of the kidneys. If your doctor does a test, he does this GFR, and that GFR tells him how much fluid is flowing through the kidneys. And if the kidney is working properly, then your GFR levels should be above 70. The laboratory minimums are 60. I'd like to see them at 90 to 95 to 100. Makes better protection for the patient. But here's what happens is that we have an effect. So in our office, we take blood pressures in postural patterns, means we take it sitting, then we lay you down, we take it again, then we stand you up and take it again. Well, when you lay down, your blood pressure should drop. If it doesn't drop and it goes up when you lay down, that tells you your kidneys are not working the way they're supposed to. And when they're not working the way they're supposed to, then your blood pressure goes up. And that can be part of the fight-flight problem. But your doctor says, here, take this drug, and they try to tranquilize your whole body. So let's talk about that these biochemical pieces. You talk about people being way too big. Well, there's a lot of people who have hypertension that aren't overfat.
Yep.
And, so that's outside of that realm, and it's the number of extra miles of blood vessels per pound of fat. But let's take it to the next level. What are some of the other triggering causes when it comes to biochemical phenomena?
Yeah, you're correct. Not everybody that has hypertension is overweight. So one of the other major factors that can be associated with being hypertensive and the metabolic X syndrome is having issues with your blood sugar. So blood sugar stabilization problems over time, as you know, makes people have issues with insulin resistance. So there's a correlation directly with the more resistant your body is to insulin, the higher your blood pressure will go as well, because insulin is involved in the way your body processes magnesium, and now magnesium is needed to keep your vessels relaxed. So if you have issues with insulin, and thus your magnesium utilization is starting to have a problem, your vessels can't get that dilation and relaxation to keep them nice and open, to keep the pressures from elevating. So that's also a big part of it as well.
Here's the problem, though. A lot of people think, okay, I'm going to go take some magnesium and drop my blood pressure. Well, and they'll come in, well, I take magnesium. How come you tell me I need magnesium? Because there are many different types of magnesiums. So you have magnesium citrate, magnesium glycinate, magnesium malate, magnesium gluconate, magnesium aspartate. And there's only a couple of them actually that have an effect on relaxing the vessels. The other have multiple other patterns of influence within the body, but the magnesium aspartate is the one that if it's tone within the vessels that we're worried about, that's the one that we give to bring things under control. 888-630-9625. That's 888-630-9625. You're listening to Dr. Tom Roselle Live. We're going to take your phone calls, and we're going to talk a little bit about the hypertensive medications and drugs when we come back after the break. Coming up the middle, many of you are online. We're going to start taking your phone calls. So give us a call at 888-630-9625. This Wednesday evening, Dr. Brice Miller will be your host, your presenter, talking about hypertension, causes and cures. Listen, seriously, if you're on hypertensive medication, you're probably doing a tremendous amount of damage. How many of you have felt weak and like you have nothing left, and you know that it's because of the medication, but your doctor says take these pills for the rest of your life because there's no way out? Well, we're going to show you, particularly when we come back, what damage it's being done. You're listening to Dr. Tom Roselle.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, my friends. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630-9625. Give me a call. My guest, your host this Wednesday evening on hypertension is Dr. Brice Miller. We're going to be talking about the causes and cures and how to get off some of the medications. Have you ever noted that sometimes your doctor puts you on medication for one thing and all of a sudden now you got high blood pressure? Or suddenly your cholesterol level's being treated and now you got high blood pressure, or that you're diabetic and then you have high blood pressure and high cholesterol? Well, all these things are related. They're interconnected, and you can't set one aside. And there's this other thing called idiopathic intracranial hypertension. We put tags on everything. It's called IIC. I don't get the movement towards all this, but that's neither here nor there. In the meanwhile, Bernice, you've been very patient.
Hi.
Hi, friend. How you doing?
Oh, doing good.
I know you're off topic, but you know what? I looked at your question, and I said, I have to find out what this is all about. What's going on?
Well, I don't know. My friend's brother, he was 90. He passed away, and he was fine, and then all of a sudden they said he had air in his rectum. Is that like a blockage or something? he died. I mean, they said that the surgery would be hard on him, and it probably wouldn't make it. So.
Well, an air embolism is in the colon or intestinal system. Basically, is an obstruction, an entrapment that's in there, and it's caused by a lot of different things. But one of the primary situations is when the intestinal system is not working properly. So you have all this putrefaction going on, and it's a gas. It can be methane. It could be all the things that that we have. Find socially unacceptable if it's passed through, but nevertheless, when there's any kind of blockage, whether it's a structural obstruction or whether it's an air blockage, those things happen. But it's rare, that this type of thing, because if you take an X-ray of somebody's bowel, sometimes you see all these kind of black shadows within the intestinal tract, and what they are, they're pockets of gas, and you can call them air, but they're I'd have to know a lot more about this, but embolisms generally are not triggered by what we're talking about. It can be. There has to be other circumstances that are involved in addition to that, Bernice. So I don't know, but...
Oh, okay. Let me ask something else. My husband has white spots on his back, and they seem to get aggravated with heat, like in the sun.
Yep.
And I think it's called Tinea something vulgara or
versicolor. Yeah, that's mold. It's fungus.
Fungus. How do you get rid of that? What natural treatments have you got?
To calm it down, you change the dietary pattern, and your husband probably not going to like it, but anything that is fermented, he needs to stay away from beer and wine and sugar and dairy products, peanuts and peanut butter and mushrooms and things of that nature, anything that converts into sugar quickly. Mold, fungus, yeast, and spores love sugar. They love that type of environment, and the more of that stuff that you put in there, the faster it's going to grow.
So would something like... olive leaf extract work?
Yeah, but you still have to change the diet, Bernice.
Okay.
You can do all the olive leaf. You can do caprylic acid. You can do succinic acid. You can do, and I can go on. Even golden seal is good for mold and fungus of specific types. But unless you change the environment, you're trying to treat a symptom that's never going to go away.
Oh, okay. All right. And on the outside, like we're putting aloe vera and vinegar on the outside. Does that help?
No, it may keep it from itching, but it's really not going to change it at all. There's out in your way. There's an old book that was out for years, Bernice, that you may want to pick up. It's really inexpensive. You can go on Amazon to get it. And Jethro Kloss, K-L-O-S. I don't know if there's two S's, maybe two S's at the end of his name, and it's called Back to Eden. B-A-C-K-2-T-O, Eden, E-D-E-N. And Dr. Kloss was a naturopathic physician, and there's a tremendous amount of good home remedies in this book, and I've used it for years to teach with and so forth. But pick it up, keep it on your shelf. It's like having an emergency medical book around, but it's from a natural point of view, and it gives you a lot of clues. But anyway, Bernice,
okay.
Thanks, hon. Thanks for calling. Appreciate it very much. 888-630-9625. That's 888-630-9625. Love to take your phone calls. My guest in studio, your host this Wednesday evening, Dr. Brice Miller. He will be speaking on hypertension, causes and cures, the 19th of the month. That's this Wednesday, 7:30 p.m. Join us. I promise you're going to get some tremendous insights. We're talking about biochemical aspects, and I talked a little bit about, and I'm going to shift a little bit, intracranial or idiopathic intracranial problems of hypertension. And the first thing that we have to understand is the skull, this cranium, these 22 bones that make up your head, they move. And they move millimetrically as you breathe in and as you breathe out. And one of the aspects, if there's any trauma or injury to the head, even slight blows or even abnormal pressure exerted over a long period of time, that the cranial plates will not move as they were designed to do fundamentally. And then what happens is increased pressure. So my question to you is, how do these things come about? We talked about them a little bit, but why? What's the mechanism? Why does the pressure build up? We've got all that fluid patterns in there and so forth. So what say you on that? How does this mechanism exert itself? The spinal fluid levels are from the skull to the pelvis to the spine and so forth, and anything that distorts that.
Yeah, any kind of disruption to the spinal system, whether it's the pressure from the cerebrospinal fluid changing because your plates aren't moving and things like that, are going to affect the nervous system pretty drastically. So, again, we're talking about just a constant stress on the nervous system causing that sympathetic response, not having that relaxation effect going on. And over time, if this is constant, you're every day in and out, you're breathing, your skull's not moving like it's supposed to, this pressure is building and building and irritating that system, yeah, you're going to have an issue with your body's blood pressure starting to rise up.
You know, the cranial plates is this phenomena that most people and most medical physicians ignore completely. And I'm really surprised that they don't respect what can happen, because it's basically like it's a hydraulic system. You can draw an analogy to a dam that has too much pressure in it as well. If we hold our breath and we sneeze, if we cough and we hold ourselves so we don't let that cough out, what we do is we cause increased pressure inside the membranes of the brain, often cause the meninges, but it's the dura, this hard matter that allows this reciprocating mechanism to pump spinal fluid up and down. And when spinal fluid pressure increases, then you see things like, glaucoma, and you see things like head pain. Ringing in the ears is another one that seems to be consistent with that and goes along with hypertension. Somebody has hypertensive patterns. Often one of their primary complaints that will tip off any doctor is that you got a buzzing in my ear. It's kind of, I got bees and I can't get rid of them. So when you see something like that, Dr. Brice, how does it parallel? How does it correlate to, the things that you treat on a day-to-day basis?
Yeah, when you hear about people having ringing in their ears or getting dizzy or having problems with their vision, things like that, you kind of start to think about the hypertension issue and check it out. So I've always been taught that a high-pitch ring can relate to liver issues, which again will affect blood pressure because your liver is your blood filter. And again, if it's getting congested or slowed down, that can affect pressure. Or I've heard if it's a low buzz, it's more of a kidney issue. So again, each symptom individually, taking a detailed history, trying to figure out exactly what's causing the problem, not just trying to treat the symptoms of the tinnitus by going after the jaw and those other mechanisms. Again, the jaw can cause that tinnitus, but why is that jaw acting up? Is it because the cranial plates are injured, they're not moving appropriately, or is it some other reason? So again, you're searching through to figure out exactly what is the primary reason the body's not functioning appropriately.
How do you begin to evaluate? Patient comes in, and every patient that walks in our office, we're going to do the blood pressure, and we're going to do it posturally. And so you got a patient in front of you, ask the question, do you know you have high blood pressure? He said, yeah, it's been up, my doctor's warned me. How do you begin to really understand the mechanism?
I mean, again, it's just through a detailed history. So if they have a high blood pressure issue, you can just talk about, how is their digestive system functioning? How do their kidneys work? How much water are you drinking? What's your diet like? What are these other factors? Do you have any issues with diabetes? I mean, those things we talked about before. Look at their weight. You kind of analyze, what their system could be having a problem with based upon what you've seen, what they're saying, and things like that is how you can go after specifically what the problem could be.
888-630-9625. That's how you reach us here. Matt, thank you for calling. How can I help you, sir?
Yeah, Dr. Roselle, I've read somewhere that if there is more than a 40-point spread between systolic and diastolic pressure, that's an indication of problems. Can you speak to that?
Actually, no. You think about it. If normal blood pressure is, I see something at 120, 122 over 68 or 70, that's totally okay. The inverse is actually true when the pulse, and that's called pulse pressure, by the way, is closer. It's narrower. When there's a narrowing of that pulse pressure, because first you got to look at what blood pressure really is. The systolic pressure, the upper pressure, is the amount of force that the heart has to exert, pushing the fluid through the arteries. The diastolic pressure is the residual pressure that remains in the arteries after the heart has finished its contraction. So if you have a close pressure, there's not a big relaxation gap. That can also, and a lot of those things point to two things. What Dr. Miller was talking about earlier with the differences between the parasympathetic and sympathetic responses. There's not enough parasympathetic relaxation, because that's what the parasympathetic system does, to allow that lower pressure to drop. It can simply be that there's not enough nutrients available, meaning magnesium, as we talked about, but also potassium, and also the sodium balance in the body might be too tense, driving that up. So you look at all of these pieces. So the upper pressure systolic, the lower pressure diastolic, you want the gap not to be huge, but you definitely want it larger than what you're talking about. So, for example, when I'm in good shape, my blood pressure runs about 116, 118 over about 62, 64. So there's a huge gap there. It's much more than what you're talking about. And so my clinical experience would have to take exception to that. But so what you're looking at is pulse pressure, and that's the difference between the two. And it's more dangerous when it's close than when it is far apart.
Well, then what is the significance of having the systolic pressure, in my case, being periodically very elevated, and the diastolic is never elevated? It's always in normal range. That
tells me that it could be a couple things. It can be a stress pattern. It can be, where you're constantly tense. And unfortunately, living in this area, you're from Reston, living in the Northern Virginia area, where, we deal with stress to the point that we forget that we have it. And so we're running around with this matrix all the time. It can be an allergic response. Sometimes you eat things, sometimes you don't, but when you eat them, you don't know that you're reacting, but it's driving your blood pressure. It can be that there's specific situations that you get into where you burn up certain minerals more so than others. Even, for example, if you're sitting around and you're a bookworm and you're reading all the time, and you're burning up B complex, you're burning up magnesium, you're burning up taurine. All these things help stabilize the different neurological pathways, and indirectly is going to have an effect on blood pressure. But blood pressure is generally only a problem if it spikes extremely high. If you spike at 145, 155, it's occasional, and then it drops back down in position. In our practice, I don't consider that an issue at all. I start looking at, the patient. I start looking at lifestyle. I start looking at what they get themselves into. I start asking a lot of questions about, where they were the night before, what's going on. Did they just walk into my office and somebody put a blood pressure cuff around them and take it? Did you walk off the street, go down to Giant and or CVS and put your arm in, in the automatic blood pressure machine coming off the street? All those things have a consideration, Matt. So,
right.
And I'd have to know a lot more about you.
Very good. Thank you.
You're welcome, buddy. Thank you for calling. 888-630-9625. 888-630-9625. That's what I was talking about when we started out the program, Dr. Brice, is that blood pressure is not blood pressure elevated until, one, it meets certain parameters. It's just because it spikes occasionally. Now, there's some patients that they're in trouble. They get it up to 185, 180, 175, and it sits up there. That upper portion is way too high. How serious of an incidence it is, it depends upon what that lower pressure is. Is the body fully relaxing? And then I want to know, are all those other things? So you can't just draw a broad brush.
Correct. Yeah, your pressures can go up, they can spike, and some people can do okay staying up there. Again, it just has to do with where your body is at that time. So the biggest problem with blood pressure elevating is not that the pressure is high, but what that does to your vascular system and how it damages the tissue. So if your tissues are pretty healthy, your body's not in a place where your blood sugar's out of whack, you don't have damage to your system, and your pressure's spiking here and there, you can probably handle that for a little while. It's not doing too much damage yet. But if you're in a place where you're diabetic, you're obese possibly, and your pressure's spiking, you're probably having a lot of damage in your system that needs to be stopped as soon as possible.
A lot of patients will come in and say, my blood pressure, on weekends, I never have a problem with it. It's always low. Well, let's find out what you're doing during the week. And it can be stress-related, but it could also be posture-related. We talk about the upper portion of the neck controlling and relaxing the body. We call it the parasympathetic response. So if you're constantly looking at a computer screen, your head's down, bent over, you're in a bad postural pattern, that camelback that we talked about earlier, it's being driven by your workplace, all of those things can drive your blood pressure up. So it's not just a simple matrix of, here, take this pill for the rest of your life. You really need to find out what it's about so you can fix it so it can go away forever. We're coming up to a break. Don't go away. We'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle live, just as you do every Sunday, 12 o'clock, right at the place on your radio that you're listening to me right now. Make sure you tell your friends about it because we're here to serve you. This program is designed to make you think, to make you question, to make you be your own advocate. My book, Ageless Health, Health is a Do-It-Yourself program, was written with you in mind. It wanted to give you a basic outline of the steps to take, what you need to do, who you need to listen to, but at the beginning and at the end, you truly, truly are your own advocate. You know, patients look at me when I say, listen, my job, if nothing else, is to make you question and not believe anybody, including me. It's to provoke you to do your own homework. And then if it fits, if you think it's right, do it. But please make sure, particularly the subject we're talking about today with hypertensive patterns, don't just take your doctor's script and go down and get it filled, because the sequela, the consequences of that, you know, that lemming attitude, if you will, is not okay. You're going to find yourself in a deeper hole than what you started with. This Wednesday evening, Dr. Brice Miller will be your host, your presenter at the Roselle Center for Healing in Fairfax. We'd love to have you as our guest. We'd love to be able to help you make decisions. That's why we do these programs. You can go to RoselleCare, RoselleCare.com. And by the way, check out this guy. You know, he's an attraction all by himself, you know. So, you know, I'll tell you something about when I was in school and, you know, my parish and this young, never mind, I won't tell you that one. So, but anyway, please join us. Not to say anything more, Dr. Miller. Take us through why should people attend this class? What are they going to learn from you? What are you going to give them? Why is it an imperative? Why is it a must?
It's a really good idea because, again, we're trying to give you an idea of what you can do to help yourself figure out what's really causing the problem and not just being complacent and taking drugs that are stopping symptoms. So what we're going to cover is we're going to go over some basics about hypertension, the different types of hypertension, what's really an underlying kind of, you know, reason that mainstream medicine talks about being a cause of hypertension. Then we're going to break it down through the triad of health. So we're going to look at the biochemical issues that are involved, like we said, the blood sugar, the obesity, other types of things. Look at the structural pieces with the spine and the skull and the mid-thoracic back. And then we're going to break it down, maybe some stressors, things like that that could be involved, and give you some ideas of what you can do for yourself to take it home, help yourself out, get yourself right on the back, or back on the right track, if you will. So pretty much it's a good idea for you to come out here. If you or anybody you know or anybody you love that is having issues with this and is not seeing results, or they're always feeling worn down, they're not happy with the way they feel, their pressure is elevated, bring them in, or you come in, everybody comes in, and we can learn. I can show you some things that might help change their life or your life.
You know, one of the things that you're going to find out by attending this class, and if you don't know already from listening to the program, that if you have hypertension, the chances are that you're already in a pre-diabetic situation and you're already in a cardiovascular impaired situation, particularly if it's existed for a long period of time. So if you're on medications, and medications have side effects, and you need to know the side effects. By the way, there's a great website. It's called drugs.com. Go in there and put the medications that you're on and stack them, and it'll show you the increased symptomatic presentations that you will have, the side effects, so to speak, the contraindications, so to speak, and find out if it's worth it, or maybe you need to be proactive and really find out what it is that you can do to help yourself. You know, I get crazy on a day-to-day basis in the office, and the patient tells me, the other day, Dr. Miller, I had a new patient, and the patient came in and they were complaining that they just didn't feel good, and they had had generalized pain for years that they've been putting up with, that their body hurt all over the place all the time. And I looked at the medications that this person was on, 19 different medications, prescription medication, 19 of them. And I sat there, so I got upset, I got angry, and I went to the computer, and I pulled up drugs.com, and I wrote down, as the patient was there next to me, all the medications that they were taking. I hit the button, and I said, you read these. And the patient just sat there, and the patient started to cry and said, they're killing me. I said, yeah, probably my opinion. That's probably not an inaccurate statement given what those side effects are saying there. I said, I think that at minimally you need to be evaluated and by several people to see what you can do to make a difference. Because when there's pain, there's a reason for pain. When there's fatigue, there's a reason for not feeling good and not having the energy. When you don't have the body that you want, you have to start evaluating the things from structural, chemical, and emotional standpoint and ask the question, what is it that I'm doing? What is my lifestyle? What am I being exposed to? What injuries have been in my body that I thought were minimal that now have a huge and significant impact on my life? And more importantly, what can I do about it? And don't forget, Ageless Health 2017, our SIC 15 on the 17th. I want you there, October. Please be my guest. Join us. Say hello. It's Dr. Tom Roselle. See you next week.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.